Hello friends, my name is Preeti. I'm a registered nurse. In today's video, we will going to talk about metabolic alkalosis. So let's get started. Whenever you see the word metabolic, think about kidney. This is a problem related to kidney. Alkalosis means pH is greater than 7.45. So if you see at the ABG results, the bicarbonate, which is HCO3, will be greater than 26 and the pH will be greater than 7.45. What happened in metabolic alkalosis? The body is losing too much acid, the H plus ion, for the multiple causes, such as if the patient is having vomiting, NG tube suction, or if the patient is on diuretics. So there is excessive loss of hydrogen ion and there is too much bicarbonate in the patient's blood. Now, as we learned in the previous video that the opposite organ will compensate. So in this situation, this is the problem related to kidney, the lungs will compensate. What lungs will gonna do? Lungs will retain the carbon dioxide, which is the acid. In metabolic alkalosis, we do not have enough acid in the patient's blood. So the lungs will compensate and the lungs will retain the carbon dioxide, which is the acid, by decreasing the respiratory rate. So the patients will breathing very slow in order to retain the carbon dioxide. We have to watch the patient for the respiratory distress or respiratory failure in this situation. Let's talk about some of the causes of metabolic alkalosis. So antacid overdose. This is very common in the hospital. I have seen many patients just taking too much antacids and they end up in metabolic alkalosis. Another is diuretics. When patients are on diuretics such as loop diuretics or thiazide diuretics, what diuretics do? They increase the urine output. Our urine is acidic, so losing hydrogen ion. So that is the cause. Excessive vomiting. When we are vomiting, we are losing all the gastric juices, and the gastric juices are rich in acid. There is hydrochloride acid in the gastric juices, so we are losing acid. If the patient is on prolonged NG tube suction, then also we are losing the acid. Also, if the patient is on infusion of bicarbonate IV, so if we are treating the patient for metabolic acidosis, the patient is on bicarbonate drip, there are chances that patient might gonna end up in metabolic alkalosis as well. Now, what are the signs and symptoms the patient present with? In order to compensate, the lungs will retain the carbon dioxide, so the patient respiratory rate will be slow. Patient may have bradypnea, and there are chances that patient go on respiratory failure. So with metabolic alkalosis, we have to watch the patient for respiratory failure. Another thing, hypokalemia. There is no enough acid into the patient's blood. So from the cell, the hydrogen ion will go into the bloodstream, and from the bloodstream, the potassium will enter into the cell. That will lead to hypokalemia. So watch the patient for the sign and symptom of hypokalemia, such as muscle cramp and dysrhythmia. Nursing intervention for metabolic acidosis, it's mainly depend on what is the cause. If the patient is having nausea, vomiting, then watch their electrolyte level, monitor their potassium. If the potassium is low, then we have to replace the potassium, put the patient on telemetry, get the ECG, because whenever patient have hypokalemia or hyperkalemia, they both put the patient at high risk of arrhythmia. Administer IV fluid, anti-emetic medication if the cause is vomiting. Watch for the sign of respiratory distress as the body will try to compensate by slow down the respiration. If the patient is on diuretic medication, then we have to hold the diuretic medication. If the patient is suffering for hypokalemia, then replace the K. The healthcare provider will give order for the potassium chloride IV and we have to treat the hypokalemia. Thank you for watching. I hope this short video will help you to understand metabolic alkalosis.